My name is Carol Sanchez, and this presentation is about why nurses quit. This is for English 2 on May 2nd, 2017. The main focus of this paper is about the reasons nurses quit and ultimately leave the profession. This article will be published in Nursing Research and Practice. The purpose of that journal is to inform medical personnel on different practices and research studies. The articles are added yearly and also go through a 4-step process before actually being published. Within the journal, the articles are in chronological order. Charts are presented to help explain more of just how bad the shortage is. There will always be a shortage of nurses at the bedside. The reason for the shortage is one of many. The nursing field will remain resilient in tasks and care given. We will further explore the reasons given on the left to better the understanding of why, and give an advice on how to rectify the situation. The reasons are poor management, lack of upward mobility, underpaid, too many tasks, mandatory overtime, short staffing, coworkers, and stress and fatigue. Having poor management skills can throw the department into a tailspin. Some nurses will say it's a lack of support they receive from their management staff, and others will say it's because they play favorites with other nurses, or management who do not value open communication and feedback from his or her staff. One common frustration is often a fellow nurse will become a manager and then forget where they came from, treating other nurses as if they can perform all of these tasks and be perfectly fine. There is no structure in certain facilities, and having a few nurses play dictator to others, and if the tasks don't get finished in a timely manner, there will be consequences. Job mobility is difficult from the bedside without an additional degree. A nursing degree overqualifies many from other jobs outside of nursing and may not pay the equivalent of a nurse's current salary. In order to obtain a job that pays as much or more than the average RN makes, additional years of school are typically required. This is a sacrifice that some may not be able to make, given that going back to school would require time away from work, which means less pay and less time to spend with family. Many nurses feel that management doesn't value them for all the tasks they do. In certain settings, nurses do tasks that would normally be done by a CNA. A typical day for a nurse is to help provide patient care, which involves bathing, dressing, brushing teeth, getting in and out of bed, and speaking with them about their care as well as to their family members. They also have to perform physical exams, health histories, provide health promotion, counseling and education, administer medications, wound care, call and receive report for new admissions, interpret patient information, and make critical decisions about needed actions, coordinate care in collaboration with a wide array of healthcare professionals, and direct and supervise care delivered by other healthcare personnel like LPNs and nurses' aides. Nurses feel they should be paid more if they are going to take on a job that should be done by 3 other nurses, not just one. Many nurses feel they don't get paid enough for doing the jobs they do. Some do jobs that 3 people should be doing. A 12-hour shift becomes a 14 to 15-hour shift. To turn around and be back the next day. Get paid for doing one job, but you're doing the job of many. Short staffing is one of the most prevalent reasons of why nurses leave. According to a recent poll on allnurses.com, more than 1/3 of 1,500 nurses polled say that continuous short staffing drives nurses from the bedside and ultimately the profession. One of the reasons for short staffing is management is cutting some costs, making it cheaper on them. However, in the long run, it ends up hurting them. Now, because of short staffing, nurses are faced with mandatory overtime. Overtime is good because it helps pay the bills, but when you're forced to pick up 2 or 3 12-hour shifts, you can become frustrated and exhausted. Not only are you tired, but the nurses have less time with their families, spending more time at work than they are at home. Bullying and toxic behavior from fellow staff can be another reason why nurses leave. Even nurses who have been there for years are known to bully. It doesn't have to be mocking or picking on, it can simply be that those seasoned nurses refuse to help the new nurses with tasks and getting used to everything around them. They refuse to mentor the new ones coming in fresh from graduation. This can be very stressful in and of itself, especially to the new nurses. Working overtime and doing jobs of many can cause nurses young and old to become stressed out and fatigued because they are taking on a workload that was meant to be for 3 nurses instead of just 1. Because you work so much and have very little downtime, there is no time to relax and unwind, which causes nurses to leave the profession more often than not. The increase in demand for nurses means it's even more critical that medical institutions across the nation make a concerted effort to engage their existing nurse population and retain recent RN graduates. By 2022, the employment needs will increase by 20.2%. Number of nursing jobs will grow from 2.86 to 3.44 million. Not to mention, additional nurses in the amount of 1.13 million will be needed. In 2010, the turnover rate was 13.8%. By 2014, it was 17.2%, steadily increasing as the years go by. My advice would be for management to make the effort to assist and help nursing staff and together work out a better routine of who does what on different days. That way tasks are getting done every day and it is divided up among the existing nurses. To weed out any staff member that is treating another poorly and try and rectify the situation. That way the more experienced nurses can actually mentor the new ones coming in. And try to boost morale with a planned work celebration by thanking and congratulating them on a job well done and to keep up the good work, and to also give incentives that help curb the workload. To pay employees as they would want to be paid for the amount of work they put in. I would advise management staff to speak to their staff on what could be different to help offset the feelings many nurses have, to help management gain a perspective on how things would be better if they spoke to their staff. It takes a tremendous amount of courage and self-control to be a nurse. In order to be successful at what you do, you have to have ambition, strength, as well as a backbone, and patience. Nurses leave for their own reasons, and some are as simple as they don't like it anymore, or they thought they wanted to do this, but it turns out they don't. The main reasons why nurses leave are as follows: poor management, lack of upward mobility, underpaid, short staffing, mandatory overtime, too many tasks, fellow coworkers, and stress and fatigue. These reasons are all causing nurses to burn out and go someplace else that isn't so stressful. It is management's job to find and help rectify the problem. Just being open and maintaining communication with your staff helps. Getting paid for doing what you love is just a bonus. Making nurses feel they are valued and appreciated for what they do would help turn this around. It doesn't take much to brighten someone's day. These are the list of sources I used for my article. The first source, Johnson explains 6 reasons nurses leave. She says for some it's a stepping stone to another career. She emphasizes poor management, lack of upward mobility, underpaid, too many tasks, and short staffing. Sanjay Gupta focuses on stress and fatigue as the #1 factors of why nurses leave the profession. Working schedules and insufficient staffing are also among the reasons. Shifts lasting 12 hours or more were associated with a 40% greater level of job dissatisfaction and a 31% higher risk of planning to quit. Stress and fatigue kick in when the workload and hours increase. There's no time to relax and unwind. Rebecca Hendren speaks about mandatory overtime being one of the main reasons why nurses leave. When you are short-staffed, managers enforce overtime. Overtime can be nice to have. In some cases, extra money is good because it helps pay bills. You can't send another nurse to another department because that nurse is now the newbie and doesn't know exactly what to do. Also, giving nurses tasks like cleaning rooms takes away from patient care and safety. Nurse Beth talks about the reality shock of graduate nurses working in the field after being in school. They had the comforts of their instructor and fellow classmates to lean on. When they start working, oftentimes the experienced nurses won't help them. Cabrera talks about short staffing and how upward mobility can be hard. For younger nurses, this is more obtainable because many don't have a family to worry about. But for the older nurses, time away from work means less pay and less time with family, making it really hard to move up the ladder.